introduce our special speaker. Thank you so much.
Great, thanks, Sarah. Thanks everybody for joining in for this lunchtime lunch and learn. We're going to keep it to an hour today, just to be respectful of everybody's time. And just so you're aware, we are recording it. If you want to look back later, or you know, want to share with somebody that you know wasn't able to join today. Any questions that you may have for Wendy, please type them into the chat, and Sarah will ask at the very end. Any questions that you have, and you can either specify, you know, that it's from you, or if you want to remain anonymous, that is fine as well. So without further ado, Dr. Wendy Troxel is a licensed clinical psychologist who specializes in the diagnosis and treatment of sleep disorders, both within individuals and couples. She's internationally recognized for her research on sleep and the consequences of sleep loss on our health, relationships, and economy. Aria Huffington recently called her one of the 5 most influential people in sleep, saying that Wendy Troxel is on the front lines of sleep revolution. Again and again, her research shows just how fundamentally sleep affects every aspect of our lives. She's passionate about helping people sleep better to improve their well-being, their health, their relationships, and their productivity. So without further ado, Wendy, will turn it over to you. Thanks.
Thanks so much. It's a real pleasure to be here. First, can everybody hear me okay? Just nod your head if so. We're good? Okay, good. All right. I'm just gonna minimize the icons. Great. So it's really my pleasure to be here today. When the organizers first talked to me about giving a talk on sort of the basics of sleep and sleep for kids, kind of knowing what this organization is all about. This was all pre-pandemic, pre-coronavirus. And so as with everything, we have sort of pivoted. And while I'll today be discussing some sort of pediatric sleep basics, I will also be covering some of the issues that you and your families might be struggling with right now in the midst of this pandemic that we're facing, and the challenges that we're facing, particularly with regard to sleep during these very challenging times. I just want to say again, it's my pleasure to be here. I think an organization that supports moms is a wonderful thing. It's, I definitely believe in the concept that it does take a hive or a tribe to support mothers who are doing the most important and very challenging job. And these times are certainly only emphasizing the challenges that we as mothers face and the need to find support in other mothers. So with that, I'll dive right in. So I just want to start by talking a little bit about the basics of sleep for children. As I understand the composition of the Hive community, it's largely made up of moms of young children. I myself have teenagers. So if you have questions that refer to sleep across the age span, I'm happy to answer those. But I want to just start with some of the early basics of sleep. So the first thing that I want to emphasize, particularly for you moms of little ones, is that sleep is the primary activity of the brain during your child's early development. Just think about that. It is the primary thing that your infant, up to about the age of 2, that your child is doing. Between the ages of 2 to 5 years, the time spent asleep is roughly equivalent to the time your child spends awake. Before the age of 2, a child is actually spending more time generally sleeping than awake. And just from an evolutionary standpoint, that should tell you how critically important this behavior is, that during these early periods of development, when there are such dramatic changes in neurodevelopment as well as physical development, really setting the stage for your child's life, sleep is literally the most important thing that they're doing. Even by the time our children each reach school age, sleep occupies about 40% of their day. Today, I'm going to be talking about several things on the basics of sleep, including how much sleep is enough, what happens when your child doesn't get enough sleep, and a lot of what I talk about in terms of the consequences of sleep loss for children also apply certainly to adolescents and adults. a little bit about normal versus abnormal sleep in children. And then I'm going to talk about the factors that interfere with healthy sleep. And really this applies in general, but it's also specifically relevant during these stay-at-home orders during a pandemic. And then some strategies that you can do to improve the sleep in your whole family. So first, we know that sleep is really a universal phenomenon, and however, our specific sleep needs do change throughout our lifespan with, as you can see by this chart, sort of as we age, our need for sleep decreases to some extent, though even as adults, generally speaking, scientific consensus recommends that adults achieve around 7 to 9 hours of sleep per night. And you can see the breakdown throughout all the other years, all the other ages. We know that far too many of us, including our children, are simply not getting enough sleep. And there are significant consequences of not getting enough sleep. First, there are cognitive effects. So when we're not getting enough sleep, and again, this applies for our children as well as ourselves, our memory and our creativity suffers, our attention plummets. So many children that aren't sleeping well, particularly school-age children, will actually show behavioral signs that mimic attention deficit hyperactivity disorder. When we don't get enough sleep, again, for children as well as for ourselves, we have difficulty problem solving, and even our decision-making skills are hampered. As far as adults go, and this is something for us all to be mindful of, although I don't say this to scare you, given that we also know that particularly when you have infants in the home, you may often be sleep deprived, but in general, if you're chronically sleep deprived, kind of over the long term, not just during those newborn stages where it's somewhat sadly normative to be sleep deprived, there is actually now evidence to show that chronic sleep deprivation and sleep problems can lead to increased risk of dementia and dementia-related disorders. Beyond those cognitive effects, we know that when we don't get enough sleep, both our mental and physical health also suffers. So again, specifically with regard to children, what you may see in your children when they're not getting enough sleep or their sleep is compromised in some way, they're going to show problems with the ability to regulate their emotions. So they may show more negative emotions like irritability. They may also be more reactive, having more temper tantrums. Depending on the age of the child, you're going to see these sort of behavioral manifestations of challenges regulating emotion manifest in different ways. So you might see hyperactivity. In teens particularly, you might see higher rates of depression and anxiety, as well as increased risk for risk behaviors like substance abuse. There are even studies that have shown links between sleep loss and sleep problems and increased risk of suicide, particularly in teenagers. There are also physical health effects of not getting enough sleep, including, and again, a particular relevance in this day and age. We know that sleep loss can compromise our immune function. Studies have shown that if you deprive healthy human subjects of sleep, they're at greater risk of developing the common cold. And I know we're all very sort of probably mindful and thinking about ways that we can boost our own and our family's immune system during this coronavirus pandemic. And I'll put it to you straightly here that one of the only evidence-based ways to improve and boost your immunity is by having healthy and consistent sleep. There's a lot of sort of unevidence-based findings out there about what you can do, what you can take to boost your immunity, but actually the evidence, some of the most robust evidence shows that promoting healthy sleep directly affects healthy immune functioning. Other physical health effects of long-term chronic sleep loss or sleep problems include increased risk of obesity, as well as heart disease risk factors. And again, you might not think this is important for your children, but we actually know that risk factors for things like heart disease and diabetes are emerging earlier and earlier in life, including in children and adolescents. And given that sleep is a long-term risk factor for these long-term disease outcomes, so important to start setting the stage for healthy sleep and healthy behaviors in your children. Particularly of relevance to teenagers, studies have shown that sleep loss is associated with increased risk of sports-related injuries and also motor vehicle crashes. In terms of what normal sleep looks like, I want to point out just a few important things because, and again, this is important to remember when, particularly for parents of young children and infants, some of the problems that occur may not be problems per se, but are partly characteristic of what natural sleep is. So the first thing I want to say is that sleep is actually an active and dynamic state. It is not a coma. So the fact that your children wake up, or your young children in particular, may wake up in the middle of the night is not in itself a problem. It's the inability to fall back to sleep that can become a problem. And so nighttime awakenings, actually throughout the lifespan, are normal. It's just that challenge that occurs for some when you can't fall back to sleep. And frankly, many of us as adults may be experiencing these challenges in falling back to sleep during these very stressful times. And I can talk some about that as well. But what I want to talk about is that this idea that sleep is dynamic and that waking up in the middle of the night is not so much the problem for your children, but it's the learned associations that they may develop between what happens when they wake up in the middle of the night and your response as the parent, and how that child may learn an association between waking up in the middle of the night and sort of what happens next. And these are some of the challenges that happen with kids who have a lot of nighttime resistance, who wake up in the middle of the night and can't fall back to sleep without mom or dad coming in and lying with them. In part, that's very normal because the child is simply looking for some cues for safety and security. And if they learn that that comes primarily from mom or dad, which again is totally normal, they may resist that if the parent doesn't return to the room. But we can talk more about that. Just really briefly, some of the challenges or what we would call abnormal sleep, and this is, I just want to raise this in case anyone on the call has specific concerns about a sleep disorder in children or in adults. These are kind of the major categories of sleep disorders. There are actually many, many more sleep disorders, but these are the primary ones. So the most common sleep disorder, particularly in adults, is insomnia. Insomnia presents a little bit differently in young children, where it's more about bedtime resistance and those middle of the night awakenings. But it's pretty similar to adult insomnia in that it involves a difficulty falling asleep, a difficulty staying asleep, or poor quality, non-refreshing sleep. Again, many of us may be experiencing some insomnia symptoms right now. Another broad category of sleep disorders that is relevant even to children are sleep-related breathing disorders. This is something to notice if you find that your child has significant sleep problems, is very sleepy or irritable or perhaps even hyperactive during the day, if your child snores or has major sinus issues or very enlarged tonsils, and if you're concerned about their sleep. These are potential symptoms of sleep disordered breathing that would be absolutely worthwhile for you to raise with your doctor. Hypersomnias are sort of the opposite of insomnia. It's when people have excessive amounts of daytime sleepiness and need for sleep. Circadian rhythm sleep disorders are challenges in sleep timing. We see circadian rhythm disorders being particularly prominent in teenagers who naturally have what we call a phase delay. So teenagers biologically are predisposed to stay awake later and sleep in later. Some teenagers have even further extremes of these circadian rhythm delays, which can make it even more challenging for them to go about their daily lives, including attending school, which happens excessively early during the teenage years, unfortunately. Parasomnia, some of you may experience these in your young children. This is sort of any sort of nocturnal behavior like sleepwalking, talking, sometimes night terrors. Generally speaking, these are fairly normative aspects of child development. The real thing to think about is the safety of your child. If they are, out walking, sleepwalking, for instance, it's really about setting up, parameters in the household to keep the child safe. But again, there's no evidence that parasomnia specifically in children or any indication of any other sort of neurological problem. It's just a somewhat normative aspect of development. And then there are sleep-related movement disorders, which generally affects adults, including periodic leg movements or restless legs. So now let's talk about some of the factors that can interfere with sleep in general, particularly in your children, but also, again, relevant across the lifespan. So pain, whether experienced by adults or children, can absolutely interfere with sleep. For children, and definitely sort of developmentally, it's important to think about if your child starts all of a sudden, this perfect sleeper, and then suddenly they're not sleeping well, think about what might be going on developmentally, like teething, that could be interfering with their sleep. And when that happens, I encourage you to not freak out too much about it. Remember that sleep, like development, is dynamic. This too will pass. That's sometimes the best sort of advice that I was given as a parent. But also, before you jump to some conclusion that your child has some major sleep problem, think about other factors that could be developmental and perfectly normal, like teething, that could be interfering with their sleep. Other medical or physical problems that your child might be having, virtually every sort of medical condition or comorbidity, as well as many treatments for other medical conditions, like if your child is on specific medications, for instance, for asthma or some other condition. Just about every treatment for another medical condition could have a side effect of sleep problems. So it's also important to be aware of, and if you're concerned about your child's sleep, to think about any medications or other medical conditions that your child has. Worries, anxiety, stress, sadness, and fear, if we lump these together as negative emotions, again, can absolutely interfere with our ability to fall into deep, good quality sleep. And I would probably put a big circle around this one because this is probably the factor that we're most familiar with right now that could be interfering with all of our sleep. Chaotic or inconsistent schedules, another one that is so critical, during normal times and particularly during these uncertain times when so much of our lives are thrown up in the air, where all the normal sort of barometers and set things in our schedule have now been removed, like going to work or going to school or daycare for our children. That can really wreak havoc on our sleep. Caffeine or too much sugar can also interfere with sleep, and it's certainly something to rein in with your children and be aware of both the quantity and timing of caffeine or sugar. I really recommend no caffeine in children or adolescents. Many adolescents are really highly caffeinating themselves as a way to self-medicate for the sleepiness that they're experiencing, and it's not something I recommend. Other things that can interfere with sleep are sort of just any sort of stimulating activities that occur right before bedtime, whether it be a rush to do last-minute homework or horse playing with mom or dad. That really can interfere with the child's ability to fall into deep, restful sleep. So really having a wind down time is quite important. And again, as I mentioned, any developmental changes. So again, before you go running to the doctor, fearful that something terrible has happened to your child's sleep, be sort of mindful of other changes that might be happening with regard to your child's normal development that could impact on their sleep. And just to sort of highlight in particular what could be going on right now that is interfering with all of our sleep. Number one, inconsistent routines. As I mentioned, with sort of the restrictions on our lives, the schools being closed, daycares being closed, parents working from home. This has really thrown our schedules into sort of havoc, and our sleep wakes schedules and our ability to sleep is really dependent on having consistent routines. This is true, you know, whether we're in a pandemic or not. One of the most important things that you can do for your children, especially now, is to institute some sort of consistent daily routine, even if your schedules feel wide open. So setting aside some time throughout the day for playtime, for, you know, some intellectual stimulation, trying to sort of make it more routinized, even though, you know, you kind of don't have to because our days are sort of free floating, but making it sort of purposefully routinized is very important for your child's mental health and well-being and their sleep, as well as yours. And those routines really carry forward until bedtime. And I'll talk a little bit more specifically about bedtime routines in just a second. Other things that are really interfering with our sleep during this day and age, stress and anxiety, particularly related to the coronavirus pandemic. It's really important that we recognize that children of various ages and depending on their development are also experiencing the profound stress and anxiety caused by this pandemic. And it's really important to sort of recognize in a developmentally appropriate way, sort of where your child is and how they might be manifesting symptoms of stress or anxiety related to the pandemic. And then also having some sort of rules in the house and healthy behaviors to try to minimize that stress and anxiety, including keeping news exposure for both yourself and your children to a minimum, and particularly making sure that, you know, distressing news is not, you know, being broadcast on the television for yourself or your children in the evening hours before bedtime. Our kids are picking up a lot, and they're also picking up a lot of our anxiety. So trying to sort of manage that is really important. We all are lacking both physical and mental stimulation, and kids in particular who are used to going to school or daycare are really lacking that, the stimulation that comes from socializing with their peers. So finding ways to provide them with some level of stimulation, whether it be through Zoom calls with their friends, doing something sort of if they're in school age, that they're interacting with other schoolmates or friends virtually as necessary, or, you know, as our restrictions are lifted, small groups, making sure that kids have some level of both physical and mental stimulation during the day, because that sets the tone. It tells the brain and the body that they've sort of spent some of that energy so that they're able to fall into sleep at night. A child who's been lying on the couch all day or been on their screen all day and has had no physical activity or socialization with another human being is just not going to be ready to go to sleep that night. And same thing with adults. We really depend on some level of both physical and mental stimulation in order to prepare our brains for a good night of sleep. Another thing to be mindful of, and this is definitely something we can do something about, because we're so lucky to live in Utah, where we get so much sunlight exposure, and outdoor activity is certainly allowed and in fact recommended, even during these times where other types of activity are restricted. Getting daily sunlight, particularly morning sunlight, is very good for your sleep and for your children's sleep. It helps to send a signal to our internal biological clocks of when we should be awake and alert. And in contrast, when lights are low, including in the house at night, that sends a signal that it's time to start unwinding and preparing for sleep. So try to get your kids as much light exposure, particularly natural sunlight, as best during the daytime, and try to keep the lights low in the house in the evenings. This is just kind of my list of what you can do to improve your child's sleep and your sleep during these times. Setting a regular bedtime and wake time. Actually, wake up time is super important, particularly these days when we don't necessarily have to wake up to go to school or work. You don't want those wake up times to drift too late because then it can cause problems with falling asleep at a reasonable time at night. Both bedtime and wake time are crucially important. Having a consistent bedtime routine, making sure that bedrooms are media-free zones, that is, no technology in the room, and children are watching their parents. So if you have your phones or iPads in your bedroom, your children are more likely to have their phones or iPads in their bedroom. Media exposure, particularly at night, can interfere with sleep, not only because of the stimulating content, but also because of the light exposure that you get from devices that can directly suppress the hormone melatonin, which signals sleep onset. You can avoid caffeine or excessive sugar. Make sure that both you and your children are engaging in some form of physical activity every day. You can engage in some strategies to reduce stress and anxiety. And if you have teenagers, you can join the growing movement to advocate and support healthy school start times, as early school start times are a known factor that directly contribute to insufficient sleep among teenagers because teenagers have this biologically driven phase delay. I want to talk specifically about bedtime routines, and this is generally for parents of younger children, but it really applies to everyone. We all benefit from having a bedtime routine, but for those of you with sort of the under 5 set, I think that this is particularly important and often a challenge. We want to have a consistent, relaxing, and simple routine that always heads in one direction, and that is towards the bed. So when I say that, I mean, and I see that it's often with clients that I've had, that they'll say, yes, I have a bedtime routine, and then they'll talk it through with me, and when I ask kind of, what are you doing? And first of all, they go through this list of activities that they're engaging in that last apparently hours, and there's all this back and forth. So there might be reading, and then it's bath, and then it's downstairs for a glass of milk, and then it's back upstairs for a little playtime, and then maybe it's another snack. And so it's all this back and forth activity, and that really does not benefit your child's sleep. You want it unidirectional, step by step by step towards the bed, so that it's a very clear end point that the bed is where we're heading to, and it's not overly complicated, and it's also not overly long. What such simple routines do for children is it helps to set the stage for knowing that the bed is a safe and secure place. That gets back to what I talked about earlier about the issue that nighttime awakenings are not in themselves a problem, it's that inability to fall back to sleep. The more you can set up a tone and a behavioral pattern that sends signals to your child that the bed and the bedtime routine is a safe and secure and predictable behavior, then you're setting them up for understanding that bed is actually a safe and secure thing for them to do. Some of the things that you can include in your simple bedtime routine might be having, a healthy, light bedtime snack, like a glass of milk or a piece of fruit, having a bath or shower before bed. I know, that always worked for my children. I will say, even though kind of in every parenting book, having a bath or shower before bed is sort of routinely recommended, I want to let you know, if your child is the one who gets really riled up at bath time because they love it so much, first of all, you're not alone. That happens to many children. And a bath before bedtime might not actually be the best choice for your child. So you really do have to tailor it to your child's style and specific needs. Some children just find bath so much fun and so stimulating that it's not actually supporting the behavior that we want, which is sort of unwinding before bed. So feel free to swap out activities that work for your child. Certainly reading before bedtime with your child has so many benefits as part of an unwinding routine, as well as other profound benefits that research has shown for the child's overall social emotional development and also academic development. So I always do recommend reading before bed. Others might want to listen to music, something sort of relaxing and social with a parent, again, right before bed. Always remember that kind of the first and last activity should be in your routine, something that your child really enjoys, that's special to them, and that generally engages one parent. And the final activity should occur in the child's bedroom, again, so that the very next step is putting the child to bed. I've seen this with parents sometimes where the final activity is, for instance, in a playroom, and then there's this transition that has to occur to the bedroom. And that transition can really throw things off. So you really want it to be stepwise towards the bed. Because I mentioned the importance of reducing stress and anxiety, I also just wanted to mention a simple strategy that can be used in children to promote the relaxation response. The most effective way of promoting relaxation response is by teaching deep breathing or deep belly breathing. We know that belly breathing, this is again true for children and adults, helps to sort of reduce the body's fight or flight response and increases sort of the opposite response, which we call the parasympathetic response. And it also reduces muscle tension and stress. You can practice deep belly breathing with your child. It's kind of fun. You can do it by blowing bubbles or blowing through a straw. You could even practice by having you and your child lie down on a couch or a bed and putting a book or other object on your bellies. And just watch naturally how when you belly breathe, and you really don't have to force it, if you're lying down, it will naturally happen, how the book will rise and fall when you breathe in and out. And it's a good visual reminder and to teach children and adults of what that kind of relaxation response when we're using our deep oxygenated breath, how that can help to reduce stress and anxiety. And before I conclude, just some tips on, when you might want to consider referring to a sleep specialist. If your child has sort of persistent sleep problems, any of the ones that I mentioned before, or if you're just unsure whether something might be going on about your child's sleep, and if it's been going on for a decent amount of time, I think it's absolutely worthwhile to first speak to your pediatrician about the concerns you're having. If you have specific concerns, for instance, if you hear your child snoring or gasping for air at night, complaining of headaches in the morning, or having excessive sleepiness during the daytime, those could be symptoms of sleep apnea, and that's also something worthwhile to talk to your doctor about. If you're, as I mentioned, parasomnias like sleepwalking are actually pretty normative in children, but if you're concerned about your child's safety or if it's happening very regularly, that's also something to talk to your doctor about. And again, whether your child has persistent daytime sleepiness or is having significant bedtime resistance or middle of the night awakenings, and it's been going on for a good, decent period of time, several months at least, then I think, or if it's causing major issues in your family, I think it's absolutely worth beginning by talking to your pediatrician and then being referred to a sleep specialist if necessary. And with that, I will conclude, and we have some time for questions.
Thank you so much. I really appreciate that. I do have a few questions that came in the chat. And if you joined us later, just as a reminder, if you have any questions, please just find the chat button. It's like a apostrophe and send it my way. Wendy, thank you so much. That was very informative. What is your experience with sleep training? Is it something that you teach? And at what age, if you do, can you start sleep training your baby? And is it beneficial or is it not?
Yeah, that's a great question, and something that comes up regularly. I mean, generally, when we talk about sleep training, there's a lot of kind of beliefs and misconceptions and fears that come up with this. Oh, I see a baby. This is where a lot of people immediately think to sort of Ferber or Ferberizing your baby, this idea of the cry it out method being the only method to sleep train. I would say, first of all, yes, I do believe in some level of helping your child. If it's the family's decision to have a child who sleeps independently, and I really do think that this is a family decision. So that's the first step. Find out what your family's goals are. Sleeping independently is a family and culturally sort of biased or based decision. I don't make judgments on whether if you choose proactively to co-sleep with your children, based, for instance, on attachment parenting. I support that, provided that it's done safely. However, if you as a family choose that you really want your child to be sleeping independently for whatever reason, maybe you want to support that independence in your child, you don't sleep well if you're co-sleeping, all these reasons, that's your family decision. And if so, yes, some level of sleep training is absolutely effective. I think that the whole idea of the Ferber method in its original form is really not practiced anymore. By that I mean this idea that you put an infant in a bed and then just let them cry for hours. That's generally not supported or recommended anymore. However, what is generally recommended is some sort of graduated approach where you're sort of gradually removing the parent's presence from the bedroom. And again, I would say that this does not happen until at least about 6 months of age at the earliest. Children, in my opinion, in my work, younger infants are going to need more parental presence, but you certainly can support the behaviors by having the child in their own sleep space, in a safe one at that, a crib, et cetera, even in those early stages, and sort of allowing them to learn. The whole idea of this sleep training is helping the child in a safe and supportive and nurturing way learn to self-soothe, to sort of get back to that idea that I mentioned, that again, night awakenings are not the problem, it's the inability to fall back to sleep. So the idea behind sleep training is that you're helping your child to learn to self-soothe back to sleep so that they don't have that learned association only with waking up and then needing the parent to help them go back to sleep. So there is a way to do it in a nurturing and kind way, but it's really important first to establish what is your goal as a family without judgment or feeling that you should be doing one thing or another. It's really a family decision.
Mm-hmm. Thank you. And that sort of segues into another question that I have from one of our mamas. She says that her 5-month-old is on a great napping schedule, but naps in her swing. Is she getting quality sleep, or is this mama doomed? Should she sleep in, she does sleep in her bassinet at night. What do you have to say about sleeping in the swing during the day?
Yeah, I mean, I think that, eventually, again, I think it's really helpful to think about, whatever learned associations your child is having. And eventually that swing may not, be appropriate for your child, as she gets bigger. And if she's only learning to nap while in constant motion, you may eventually have challenges transitioning her, for instance, into a crib for nap. And so more from that perspective, I would say kind of allowing her some opportunity to practice sleeping in an actual crib or wherever her sleep space is during a nap will probably pay dividends in the future, because it might be hard to transition her out of that. On the other hand, I am also of the mindset, if it ain't, if it's not broke, don't fix it. So especially during these times, so I also want to have some compassion. If it's working for you and you need right now to get her to nap, I also understand if you make that choice, because I think particularly with young toddlers in the home, or really little ones in the home right now, you're going to have to do what is working for you, and just be mindful that you are creating sort of learned habits. And so it's always easy to switch that habit. So I think you have to balance what's working for you right now versus ultimately she probably is going to grow out of the swing. And so you may want to give her some experience in sleeping in a nap so that she doesn't only have that experience of napping while in constant motion.
And what do you, we have another question about location, and has to do that. She says, how can I help my 3-year-old stay in his own bed? I remember this. He comes to my bed overnight when he wakes. Usually I'm so tired, I just let him come in. Has she created a bad habit?
Yes, I mean, again, believe me, I've been there myself too. And I mean, and that's another example of a learned association. And particularly once your, toddler becomes mobile, and if they're in a big boy or girl bed and they can actually get out of their bed versus a crib. I remember that myself. It was like, oh my God, so daunting, because suddenly there was this whole new world of freedom for them to then actually come into your room and wake you up in the middle of the night. And it is often, I agree, far too easy for them just to snuggle up and get in bed with you. And again, as much, I don't judge that. If that works for your family, it's what, if it's what you're choosing to do right now to protect your sleep, to protect your child's sleep, again, you need to make that as a family choice. On the other hand, do realize that, habits that form now, are not going to just break overnight. So your child, the more your child sort of gets out of bed and snuggles up in bed with you in the middle of the night, the more they're going to get used to that. So if ultimately your goal is for your 3-year-old to be sleeping in his or her own bed at night, my recommendation is that, when he wakes up and he comes into to your room at night, as painful as it is, you sort of gently guide him back to his room, and you encourage the behavior of, going back to sleep in his bed. You want to keep those middle of the night interactions as minimal as possible so it doesn't become reinforcing. You can also reinforce the behavior that you want, which is having your child stay in his or her bed throughout the night by doing, some sort of reward system, like a sticker chart, where successive nights of doing the desired behavior, which in this case is staying in his bed at night, earns some, special, treat. And in my work and my opinion is that treats, rather than being not food related or sort of a thing, often the best kind of reward for a child is some special activity with a parent. So, maybe it's going, on a bike ride, or going for a walk, or playing a special game, or an extra book, sort of building in that reward system for engaging in the behavior that you want, which is to have your child stay in his or her own bed at night.
Mm-hmm. And then what about the newborn, for the newborn mamas? Is there a month when they transition out of the bassinet in the bedroom to their own crib? Do you have a recommendation for parents with newborns?
I don't like to have hard and fast rules. I think it's really important to talk to your pediatrician about sort of general safety issues. I mean, and certainly regarding safety of bedding, wherever your child is sleeping, whether it be in a bassinet or a crib, making sure to follow the rules about limited bedding to reduce the risk of SIDS. And I really think that, I think recognizing that, sort of the developmental needs of young infants, certainly expecting your, 3-month-old to sleep through the night is, for most of us, not realistic. So I think having some realistic expectations that you talk through with your pediatrician is the best bet. And recognizing that, those first few months are hard, and getting the support that you need, because you are likely sleep deprived. So also getting the sleep you can. But I don't have hard and fast rules, because except when it comes to safety, that again, I think you need to talk to your pediatrician about, because I really want to mostly support families making their decisions that work for their family and with their particular circumstances of their family.
Mm-hmm. That's great. We have a few more questions and a few more minutes. So I had this question came in. What are the signs we should look for with regards to a toddler regarding transitioning out of a midday nap? What does a successful transition look like, and how long should I anticipate the process taking?
Oh, that's a hard one. It's so kind of individual, a bit idiosyncratic, and it's so hard to know sort of, you know, I can't give you a direct answer about sort of specific timing. I can say that, you know, certainly by the, you know, by the age of 5,
Right.
they will be out of their nap because they will be likely getting ready for school, but individual toddlers' needs are different. So I think that, you know, the typical transition goes from, you know, earlier on from the 2 naps per day to that hopefully nice, long, solid nap. And I'll be honest with you, with my own children, I tried to lengthen that developmental period as long as possible.
Got a lot done.
I needed that time. And, you know, there's something to be said for keeping that nap time, whether or not your toddler is actually sleeping. And again, this is where it's, I think, idiosyncratic for different children. I think keeping that time as sacred is good for you and good for the child. It is okay if your child doesn't actually sleep to allow them to have some quiet time, quiet independent time in their room. And, you know, for instance, looking at books or doing some quiet activity. For me personally, that was important because I saw in my children, and I've seen in other children, that even if they're not a child that is sort of is still needing the nap per se, just the period of unwinding and sort of lack of sort of external stimulation was really good to help settle them emotionally, and also, if I were home, to give me a break. So I think it's really going to depend on your child. It's not essential that you demand that they fall asleep, but having that routine consistent, and again, making sure that you've set up a routine beforehand, before you get to these transitions, is ideal. You can still have them have that period of quiet time so that they can kind of pull themselves together, and that can help to sort of reduce the other manifestations of a sleepy child, which include, you know, lots of tantrums, falling apart. Those are actually the signs you will see to directly answer your question. If your child is not ready to get rid of the nap, is that they'll start to generally manifest that with lots of irritability, tantrums, falling apart before bedtime. But again, my best strategy is, even if they're not going to sleep, still maintain that time in a part of their daily routine to have some quiet downtime for them to kind of pull themselves together. I think that has a lot of benefits.
Mm-hmm. That's a great suggestion. We had a question about, do you have any information on glasses that are supposed to block blue light from technology for parents and children?
Yeah, I don't have any sort of particular product that I, you know, like more than another. There are lots, you know, you can look on Amazon, and there are lots of these blue light filtering glasses. And, you know, I would suggest just, you know, look at the reviews and pick. I will say that, you know, there is a benefit of having, you know, these glasses that filter blue light. They certainly can help some, particularly, you know, in this day and age where we're all on our screens a lot, even a lot more than usual. It does help to eliminate some of that blue light exposure. But I will say there is nothing, it does not replace the behavioral activity of not being on your phone at night. Mm-hmm. And remember, the 2 factors that cause sleep interference related to technology use are, number 1, the light exposure. So the blue light filter can help with that. But the other piece, blue light filtering glasses do not help. And that's the stimulating content that we're consuming when we're on our devices. So I always want to recommend to people, yes, I think limiting our exposure to blue light by wearing light filtering glasses is a great strategy, but remember, it doesn't replace the behavioral choice, which is to not be on your phone, your iPad, or computer in the hour before bedtime.
Is that why Kindles are okay? Because it's generally like reading, or is a Kindle considered an electronic as well?
You know, Kindle is considered electronic as well, and it does have light exposure, but you can adjust it. I mean, to be honest with you though, I mean, I think generally reading a book in the evening, whether it be a, a regular book or a Kindle, I'm less concerned about that than what most people are doing, which is scrolling through their iPhones and looking at Facebook. So let's get the behavior of reading before bedtime is probably one of the best things that you can do, that your child can do. And for adults, I do recommend that you don't be reading the news right before bedtime these days.
That's great. Okay, we have one more question, and it is in regards not to babies, but in regards to something you had said. Let me find it. Okay. What is the relationship in studies that have been done to explore insomnia as a possible cause of Alzheimer's?
Yes, that's some emerging research that's coming out that is looking at the role of sleep in contributing to Alzheimer's disease and related dementias. Without getting too much into it, what studies are showing is that, first of all, during sleep, the body's what's called glymphatic system, which is basically the system that happens, it sort of flushes out any toxins in the brain. That is actually heightened during sleep, even as compared to wakefulness. So if you deprive someone of sleep for a long period of time, basically you're reducing the body's ability to sort of flush out those toxins. And those very toxins are the ones that studies have also shown, particularly in animal models, are associated with the development of the type of plaques in the brain that are associated with Alzheimer's disease risk. Now, just on I get these questions all the time, and I know that we're all flooded with, and I told you about many of the consequences of insufficient sleep in my talk today. And I want to say, for those of you who are prone to insomnia, I realize that there is a challenge here, because on the one hand, I'm telling you there are all these bad things, and you can look at the news to see there are all these bad things about not sleeping well. But if you're suffering from insomnia, I can tell you that it is not going to help you to worry about the consequences of not sleeping. So what I will say is, yes, that is true. But if you're somebody who's having trouble sleeping, thinking that you're going to develop Alzheimer's disease is not going to help you. So remember, these studies are emerging, they're really long-term, and, focus on what's going to help you and what works. And yes, if you have a sleep problem, let's treat it. But focusing on the worry is certainly not going to make your sleep problem better. So try to rein that in and realize maybe it's a motivator, but don't use it as, oh my God, the world is going to, the sky is going to fall. Because the bottom line is we all have sleep problems at some level, and particularly new moms are going to have some challenges with sleep. Worrying about the long-term consequences is not going to help you. However, changing some behaviors right now to improve your sleep is absolutely good for your overall health and well-being.
That's wonderful. Thank you so much. And in addition to emailing you, and I'm sure you don't want us calling you, what are some other ways that we can follow you? Are you on Instagram or Twitter, or what's a good way to follow you, Wendy?
Yeah, so I do have a Twitter feed, and I talk about a lot of sleep stuff. It's Wendy at Wendy Troxel. And you can also sort of Google me for sort of latest talks that I'm giving. I actually have 2 TED Talks on sleep that I would love for you all to see. One is on sleep and school start times, a topic that I'm really passionate about because teenagers are really prone to insufficient sleep. And my newest TED Talk was on sleep within couples and how sleep affects our closest relationships and how our relationships affect our sleep. And I have a book coming out on that topic next spring.
Oh, wonderful. Well, maybe we can have you back after we all read your book. So.
Okay.
Yes, that would be wonderful. Well, on behalf of all our members and the founders, thank you so much. This was very, very interesting, and good luck to all of you ladies, and I wish you a beautiful day. We did record this, so we will be able to send it on to friends who missed it, and I wish you all a good night's sleep tonight.